thank you very much for Dr. Yamamoto and Stephanie for giving me like a great opportunity to be here today. So I'm going to talk about the situation of the surgical education in Japan and our challenge for that. So how we can use this? Okay. This is my disclosures. Let me start to talk about the surgical treatment for the GIS cancer in Japan. With a wide spread of minimally invasive surgery, we do a laparoscopic colectomy by 60% for colorectal cancer. And as for the stomach cancer, we do 30% of laparoscopic gastrectomy for gastric cancer surgery. And when we look at the short outcome of the treatment, and mortality is very low, especially in the minimally invasive surgery for GS cancer. And this slide shows the global surveillance of cancer survival in many countries by Lancet. Now you can see here also the 5-year survival is excellent in Japan. So our clinical outcome is not bad, but we'd like to improve it better, make it better. And one of the important key role is the education. So let's talk about the education. And this is my understanding of the situation, the structure of the surgical residency in US. And ACGME and ABS and the check and maintain, the support, the quality of the surgical residency in US with the cooperate with the Society of APDS, AC and CGD and ACS and so on. And each institute, educational hospital, developed their own programs that based on the ACGME principles. And when we look at the Japan, there's no ACGME and no society which is in charge of the education. And each society, hospitals, teaching hospitals, develop their own programs without any standard model. Let me explain about the surgical residency path in Japan. After 6 years medical school, the resident took part in the postgraduate internship for 2 years. It's mandatory. And after 2 years, and the resident could take part in the core surgical residency for 3 years. And after 3 years, they could apply for the board certification for surgery. And one of the issue is we didn't share the information about the situation of a surgical residency program in Japan. So we conducted the survey, and which looked into the situation of the surgical residency in Japan. We mailed the questionnaire to 76 residency programs in Hokkaido Prefecture, and we asked their situation in the general surgery and thoracic surgery and cardiovascular surgery residency from PGY 1 to 5. And let me explain about the Hokkaido Prefecture. The Hokkaido is the northern island in Japan, and there are 3 medical universities. And also, there are a lot of affiliated hospitals around Sapporo and in the rural areas. And we asked, and how we can go back? Okay. We asked the questionnaire about if there is a program director or simulation, and if there is evaluation for resident and program itself, and the satisfaction with the educators. And the response rate was 64%. And finally, we analyzed the 36 programs. The background of the participated program, there are university hospital and affiliated hospital of the university and community hospitals. And the first question is about if there is a responsible person. It's like a program director. Is it or not? The 80% of the program said yes. But when we look at this education work of the director, And surprisingly, their working hour for education was less than 5 hours per week. And the frequency of interview with resident, the educator met the resident when they needed, most of that. And the question about the simulation, and 44% of the programs had the simulation center or skills lab in the hospital. But when we look at the frequency of the usage, they use the simulator irregularly, not regular programs, and mainly use the box trainer to practice the laparoscopic procedures, like this. And as for the evaluation for the resident, the only 56% of the program evaluated the resident performance and using the checklist. And the same things in the evaluation for the program itself. Only 53% of the program evaluated their own programs, and mainly questionnaire by a resident, and some of the program evaluated by program committee and publication number. And we asked the satisfaction of educator for residency program. Only 8% of the educators satisfied their programs. What gets wrong? So the main reason of dissatisfaction for residency is lack of curriculum and lack of teaching time and environment and budget. So finally, we asked, what do you need for the director? They needed simulation environment and the education society, which is in charge of education and support and give the information for the educators. So, and this is the summary of the result. And after the result of this survey, we conducted the Surgical Education Summit, which could share and give the information for each other by the educators of surgery. And we also established the Japanese Association for Surgical Education, JSES, last year. And the mission of the JSES is providing and sharing the information and fostering the surgical educator and developing the standard program and the tools for the surgical education and promoting the research about the surgical education. And as for annual conference structure, we conducted with the workshop, with the small group discussion and lecture, keynote lecture, and presentation discussion. And we will start the counseling for surgical education research from this year. And this is the satisfaction of the participant. Last year's JSES conference and the workshop and the lecture and presentation session, most of the participants are satisfied with over 4 out of 5. This is, we just started at JSES, the Society of the Surgical Education in Japan. So we would like to contribute, collaborate with Japanese Surgical Society and JSES, and we'd like to contribute to improve the patient outcome, quality of the surgery. And in the near future, and we'd like to collaborate with JSES and the PTS, ASC, to contribute to the global surgical education in the world. Now, finally, I'd like to thank Dr. Fried and Dr. Feldman and Dr. Basilio and MIS members of McGill. I learned a lot from McGill University about surgical education when I was in Montreal. And this picture, there are the young colleagues in Hokkaido University. I'm working with them now. And we'd like to contribute to the surgical education, not only in Japan, but also in the world in the future. Thank you very much.